Okay, good evening. The October 26, 2010 meeting of Human Services Committee will now come to order. Will the clerk please call the roll?
Miss Andrews. Mr. Daniele is excused. Miss Cayley. Mr. Lightfoot. Dr. Quattro. Mr. Rocco. Chairwoman Draw.
Here. Now, I know we have several speakers signed up to speak tonight. Madam Clerk.
Please come forward when your name is called and address the Committee of Human Services. You will have 2 minutes to share your concerns and comments, and please conclude when the timer sounds. Our first speaker will be Patty Starr.
Hello. Can you go to the podium with the speaker, where the microphone is?
Okay.
First of all, my support service person is going to talk, and then I'm going to talk. Do we get 2 minutes each?
For each person signed up gets 2 minutes.
She just wants to speak for about 30 seconds,
Okay.
and then I'd like to speak.
Fine.
My name is Muffy Cullen, and I was born and raised in Rochester, and I've been working as a support service provider for deafblind people for 3.5 years. And I see the many important things that deaf clients are able to do because they do have support service providers. They are able to go shopping, go to the doctors, buy clothing, and go to different events within the community. I realize that the support service provider role is very important to deafblind people because without us, they will be isolated and will not have the availability to receive the kinds of help that we have been providing. So I'm asking you to continue supporting the Center for Disability Rights Support Service Provider Program. Thank you.
Thank you.
Hello, my name is Patty Starr, and I am deaf and blind myself. I have Usher syndrome, which causes generational blindness and through retinitis pigmentosa and also deafness. And I was diagnosed at the age of 25, and I was working then at a hospital. I'd been at the hospital for 20 years total until I was 40 years old, and my eyesight was so significantly deteriorated that I could not go to work anymore. So I went to the Helen Keller National Center on Long Island. They provided me with some wonderful training to allow me to be independent and to be able to move around here in Rochester. And I learned their program of support service providers and how they were able to be helpful to me in maintaining my independence here. And when I came back to Rochester, I realized that Rochester had no services for deafblind people. There has been no service, and the Association for the Blind and Visually Impaired was unable to provide us with this service. So we asked the Support Service Providers Network to be established 10 years ago, and it finally was. And it has been run by the Rochester Center for Regional Center for Independent Living. And that was 10 years ago that it has been going through the process of providing us with services. But there's been money problems, and so it was transferred to the Center for Disability Rights, and they have been providing the services more recently. Twice the services have been not funded, and we haven't been able to receive services. And we've had to go out and do fundraisers ourselves in order to raise money for this program for simple daily needs of independence. There was no funding, and so we were able to work with various different deafblind people and support services providers and the Center for Disability Rights to save the program and keep it running. And now we realize that there's not a sufficient funding stream for us. And we are asking Monroe County to help us to keep the support services provider program going, because without that program, I will be lost in the community here. I will lose my independence, and I will be isolated. And that will lead to more depression, more anxiety, and it would become more difficult for me to live here in Rochester. So I'm asking that we maintain this program to provide this service for deafblind people in the Rochester community. Thank you.
Thank you.
Okay. Thank you.
Our next speaker is Dean DeRusso.
Work very close with deafblind individuals, and there's a big struggle for everyone to get out into the community. If there's no SSPs provided, then they're stuck at home, so that means there's no services provided for them. SSPs provide a lot of visual information and independence to people who are deafblind. I do have a handout for you that I would ask you to please read carefully. This service of SSPs really helps deafblind people become independent, to go out and to get out of the darkness, and to go out to the stores and just do daily living services. And when you cut the City Pass program, that program was actually helping fund the SSP services. We've tried to fundraise, but right now it's just very difficult. There's just so many other people out there asking for services and for fundraising support that once the City Pass program was cut, we're really lost a lot of money. So we need help. We're asking Monroe County to please think about it. I'd like to meet with you guys and ask for you to please be interested in this issue. It's very important to us and the people we provide services to. November 1st is the day that we have no money left, which is next week. So the services will be cut. I do have my contact information at the bottom of this handout. Please feel free to contact me at any time. I would like to discuss this matter with you in depth more. This is a very important program. We need to reserve funds to help our deafblind citizens, because please keep in mind, Rochester has the largest deaf population per capita in the nation. So deafblind people and visual loss from old age, even if you are young and can see, there's a time as you get older that you may lose your vision. And what SSPs provide is independence and training for these people to live independently. So I am hoping that all of you take this under serious consideration to provide funding for this important service. Thank you.
Thank you. Thanks.
Our next speaker is Sarah McMillan.
Hello, everyone. My name is Sarah McMillan. I am a deafblind citizen here, and I do use SSP services. That helps me go around to the community and do the things I need to do. Because I am a responsible citizen, and I have SSPs with me who are able to hear things around me and to help tell me what's going on visually in the environment. They may tell me that there's a car on the side of the street or that there's somebody standing next to me. And also the outrageous amount of benefits that I've received from SSP services is something that I just can't even explain. In the back, we've got interpreters that you can see providing services, which we have money for that, but I would like you to reserve some money for SSP services, because some of us that are sitting there as of November 1st won't have a way to get to the grocery store. There's important for you to please consider helping the deafblind community and preserving our services of SSPs.
Thank you very much.
Our next speaker is Brian Lloyd. Our next speaker will be Ronald Boucher.
Hello, everyone. My name is Ronald Boucher, and I'm here for my wife, and she is also deafblind. So I'm here speaking for both of us. Many years ago, my wife never used an SSP. When we finally learned of this fabulous service, it really opened up our world, and it's a valuable resource for independence in our community. Whether we need to go to the library, to a doctor's appointment, to the grocery store, or anywhere else that you may take for granted. These are things that SSPs provide to us so that we can have independence. Same as recreational opportunities. SSPs have really opened the world for my wife and for me, and to take herself around Rochester independently. So thank you for listening and realizing SSP services are so important.
Thank you.
Our next speaker will be Holly Barnes.
Barnes, and for 5 years I have worked for CDR, the Center for Disability Rights. I have worked as an SSP for 3.5 of those years, and I have found it very enjoyable and rewarding. But what I have noticed is that the Rochester community is not accessible unless there are SSP services to deafblind people. And I noticed that then our deafblind members of the community are lost. They're not able to participate. They don't have any advocates or any SSPs to provide this independence to lead them into the community and the other services that are available there. Then they don't have any access. And I have noticed that then the people are stuck at home and isolated. This is a city, and we have the services available. There's a multitude of reasons why the SSP program is so valuable and important. It meets these people's needs. I wish that you could see the amount of independence it provides for people. You know, if you meet people that are deafblind, it does take patience and time, but it's impressive when people actually take the time to welcome them as members of the community. And I have just noticed the Rochester community really values having these people as part of it. So deafblind people have the right to be part of a growing community here in Rochester. Please provide these services to the community. Make it possible for them to advocate for themselves. Thanks for listening.
Thank you.
Our last speaker is Ray Kenny. Please come forward.
Hello, my name is Ray Kenny, and I am a certified interpreter, as well as having an interpreter here with me. So I just want to make some clarifications between a certified interpreter, and an SSP, and the different roles that they do serve. As an interpreter, they are able to facilitate communication between an individual and another individual, whether or not they are deaf-blind or hearing. So that's the role of the interpreter. The role of the SSP is completely different. The SSP provider will go and pick up the deaf-blind person and say, bring them to Wegmans. The deaf-blind person will just say then, you know, this is what is on my shopping list. And the SSP will take them to the specific aisle in that area and show them where it is and communicate with them and give them the visual information that you may take for granted, such as seeing something that's on sale, seeing a new item, or just telling them in the general store where they are at. Another thing that they do is tell background visual information about other people around. So if you see the interpreters back there that are doing specific kind of interpreting for deaf-blind individuals, maybe low vision or something that's tactile, you'll see somebody signing in another person's hands. So there are different needs, and those are the different roles between an interpreter and an SSP. So thank you for listening.
Thank you very much.
This concludes the public forum.
Is there anyone present who's not signed up to speak that still would like to speak? Would you come forward and give the clerk your name? Thank you.
Hi, my name is Stephanie Aldersley. Some of you might remember me from my past service in this honorable body, and I'm here today to support the support services personnel concept. These people have been invaluable to me in my classrooms at NTID. And I want you to try to imagine yourself deaf, unable to hear, and then slowly losing your vision also. It's a very common situation. It's called Usher syndrome. So many of our deaf students gradually lose their vision over several years. It's very isolating, as you can imagine. A blind person can hear, can watch TV, can listen to the radio, can talk to friends. A deaf person has freedom of movement. They can see everything around them. They can understand sign language. They can watch TV with captions. A deaf-blind person is in a totally different situation. So anything that Monroe County can do to make the lives of deaf-blind people easier, this is a wonderful thing for me to see. Most of the support services personnel are deaf themselves, and they are working to support their deaf-blind friends. And it's just a fantastic program, and I hope that the county will find a way to continue to fund this program. Thanks so much.
Thank you, Stephanie. One more, please. Yes. That's it. Thanks.
Hello, everyone. My name is Heather, and I am a second-year psychology major at RIT. So I know that many of you have already gone to college. And imagine if you just one day in your college career had an SSP services and you couldn't go to college anymore. Imagine. I have a 3.1 GPA, and I can't go to college in the winter because I don't have any SSP services. I can go to the grocery store right now because I haven't lost that much of my vision, but deaf-blind people themselves need to go to college so I can get a degree and have better jobs and be a productive member of society. So SSPs are valuable not only to me, but as to the community as well. Thanks.
Thank you very much. Okay, so we're done. Okay. The next item on the agenda is the approval of minutes. You have before you the September 28, 2010 minutes. They will stand approved unless the clerk is notified by any change at the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 10-307.
Moved by Legislator Rocco, second by Legislator Quattro. Is there any discussion on this? Legislator Andrews.
There we go, excuse me. Through you, Madam Chair, the services AARP, it's an independent agency, and they have no direct reporting responsibility to MCH, but they're there to serve the community. They organize AARP national events, training, a variety of different AARP initiatives, nothing specific to MCH exclusively.
Thank you. The referral indicates that they've been at MCH since 2000. Is this 5-year license agreement similar to the license agreement we've had in place with them for the past 10 years? Through the chair.
Through the chair, yes. Other than inflationary adjustments, it's identical.
Okay. Thank you very much.
Thank you. Any other discussion? All those in favor signify by saying aye. Opposed? Item carries. Next item.
Referral 10-308.
Moved by Legislator Quattro, second by Legislator, by the President. President Adair. Any discussion on this? Legislator Lightfoot? I'm sorry.
You, Madam Chairman, to the administration, I want to confirm that this referral has the county conducting water quality monitoring for Durant Eastman Beach for the 2011 swimming season. To you, Madam Chairman, to the administration.
Through you, Madam Chair, yes, that's correct.
Thank you.
But any other discussion? No? Okay. All those in favor signify by saying aye. Opposed? Item carries. Next item.
Referral 10-309.
Moved by President Adair, seconded by Legislator Quattro. Rocco, I'm sorry. Any discussion on this? Legislator Andrews.
Thank you. Through the chair, this is the second year of a 3-year grant. Are there any measurables on the performance outcomes that are available for us?
Through you, Madam Chair, really it took most of the first year to get this all set up, so we really don't have that kind of data, but we certainly anticipate that in the future we will have good outcomes, and we'll be looking forward to sharing them widely.
Thank you.
Any other
That's it.
discussion on this? All those in favor, please signify by saying aye. Opposed? Item carries. Next item.
Referral
Moved
10-310.
by Legislator Rocco, seconded by Legislator Quattro. Any discussion? Seeing none, all those in favor signify by saying aye. Opposed? Item carries. Are there any other matters to come before this committee? Legislator Andrews.
Thank you, Madam Chair. I do have several issues I'd like to ask some questions about this evening. First, in regards to the speakers who came in tonight, could the Commissioner explain what's happened with the SSP program? It's the first time I've been aware or learned, and again, just from what was indicated this evening in the testimony, if this program has been cut, if that's a cut in county funding, when that cut is effective, what's happening to people who currently receive the SSP service, and if you could explain the November 1st deadline. Any information you could provide at this point in time would be very helpful.
Madam Chair, we're actually unprepared to address the issue. We weren't aware that this would be brought up tonight, and we really don't have the answers based on the folks that are in the room tonight, but we'd be glad to look into this report back to the committee on or before the next committee meeting, if that's acceptable.
Through the chair, certainly I'd like to learn more about it at the next committee meeting, but could you confirm at least that this, has the county cut funding for this SSP program effective November 1st?
I'm being told by the Commissioner, Madam Chair, that this is not a county program. We have not funded it in the past and have never funded it as far as we're aware.
Through the chair, then perhaps could somebody just explain a little bit or put into context for me what the speakers were addressing? There seems to be a belief, at least, that this is somehow county funded, or at least perhaps a contract the county has with CDR to provide this service.
Madam Chair, I think we're still trying to sort out the concerns that were brought to the committee's attention. It's my understanding that we don't have such a contract and have not in the past, but I would really prefer to spend some time on this issue so we can get you a complete picture of what the situation is.
Thank you. But through the chair, can I just ask this question? The speakers raised a November 1st deadline. Our next committee meeting, I believe, would be after November 1st. So could someone at least confirm or deny if there was some sort of communication indicating a November 1st deadline or a cutoff for funding or services for this program or something?
Madam Chair, we're not familiar with that deadline. We really would prefer to spend a few days looking into this, and if we'll check into the deadline issue immediately, so that if there is an important deadline, we obviously want to make sure that we don't miss it just because we don't know the information. So we'll look into this immediately and report back as soon as we have information for the committee members.
Okay, perhaps if it'd be possible then, if we can touch base on this by the end of the week then? I mean, that would be prior to November 1st. Would that give you enough time to gather some information? I mean, it seems very timely, is my point.
Yeah, Madam Chair, we'd be happy to do that. We'll look into it right away.
Thank you.
Thank you very much.
Satisfied? Thank you.
Yep.
You have another?
I do, thank you. The past couple of cycles I've brought up the child care issue, and my limited understanding of it is that there was a cut from the state in terms of the amount of allocation that Monroe County will be receiving. And my understanding from reading media reports is that the county continues to, or plans to continue to fund families that are currently receiving child care services, but will not allow any new applicants to receive daycare subsidies. And I guess at this point, I would ask respectfully through the chair if the commissioner could explain the plan for child care for the foreseeable future, please.
Through you, Madam Chair, I'm happy to give an explanation. We did receive notification that New York State cut the child care block grant allocation for Monroe County by $1.2 million for the period 4/1/10 through 3/31/11. Remarkably, the notification for that came 4.5 months after it was effective. So one of the concerns that we always have and that we frequently discuss in this chamber is the fact that we spend nearly $3 million a month for our child care. So it's important for us to have timely and reasonable control over the way that we handle the allocations that we receive from New York State. When we learned that we had received this funding cut, we chose to manage what is for this community an extraordinary additional cut to what we have experienced in the past, given the demand for services. We chose to look at it a little bit differently. Typically, the response to a funding cut in a child care block grant is to reduce the eligibility rate. That has occurred in this community in the past. What we know about that is as soon as you, concurrent with the lowering of the eligibility, people that fall within the window between where we were and where we go to are actually displaced from their child care. So we looked at an alternative to that, which does not displace anyone. We kept the eligibility rate at 165. However, we will choose, we will monitor what is available to us from a funding perspective and turn on and turn off the ability for people to be approved for additional daycare. So that what that means is no one was displaced in this process. That was the first step involved no one being displaced in the process, and in addition to that, it affords us the opportunity to be more responsible with what are local taxpayer dollars and to allow ourselves more control over the incredibly and repetitive late responses from the state with regard to what our allocation is. So both of those things are more in our control now than they used to be. The second piece of it is there is a second fund of money that is available to Monroe County. It's not available to every community in New York State, but it is available to Monroe County in the form of some additional child care dollars. We call it, it's a child care demonstration project. We call it in this community child care dollars, and it is funded by New York State, and the money is funneled to the county and managed in cooperation with Children's Institute. It was money that was brought in through Assemblywoman Susan John. We worked with Children's Institute and the state government officials to allow the child care demonstration project to accept lower income families in a seamless process, where when our child care block grant is not available anymore, when those funds are exhausted, they can actually in a seamless process roll over into the child care block grant. Into the Child Care Dollars program, which enables families not to, so it becomes an administrative responsibility on our side, but allows families to get additional dollars. That's an especially notable change that's different from previous years as well. The Child Care Dollar program was set up to begin to pick up wherever we ended in Monroe County and go up to 275% of the poverty level. What happens in terms of just practicality for a family is once you hit somewhere around the 200% mark, it isn't worth it really for the obligations of the paperwork, et cetera, for families. So that particular pot of money wasn't being fully exhausted. This allows us to blend our dollars and fully take into account all of the money that's available to this community for child care subsidies. It was an agreement we were able to reach with the Children's Institute and state government. So we'll be fully utilizing all of those dollars, and we will be monitoring on a regular basis the Monroe County Department of Human Services staff in cooperation with Children's Institute for their part in this. We'll monitor what's available, and the ability to accept new applications will be controlled based on how much money we have at any point in time.
Thank you very much. I appreciate that summary, and certainly I'm very pleased to see that no one has been displaced from receiving the child care subsidy at this point. And I'm glad that a solution was put together that seems to meet a lot of needs. Was this communicated to the providers of child care so that they're aware that this is what's now in place at this point in time?
Through you, Madam Chair, yes, it was on the day that it was announced to the public. The Daycare Advisory Council received a letter from me. It was delivered via email so that they were aware of what was happening. Several people were involved in the upfront negotiations with regard to coming up with a plan to address this. So the early childhood development folks were involved in the process very early on, and all of the providers were as well. We asked that if anyone was aware of a provider that would be involved in this that was not included in what would be my daycare advisory distribution list, that they feel free to share it with anyone that they could. Several of them did ask me questions with regard to it. We clarified their questions and are working in cooperation with them around it.
Great, thank you. And at this point in time, are you also able to maintain the quality differential?
Through you, Madam Chair, yes, we are.
Thank you. And is this sort of the plan that you have in place, I'm assuming, through March of 2011?
I'm sorry, I didn't.
Is this what you're planning to, or are you planning at this point in time to keep the eligibility level at the current 165 and to assess new applicants as feasible or not through March of 2011?
Through you, Madam Chair, it would be our intention to do that if it's at all possible as we look forward to the coming year's full calendar year budget for the Department of Human Services.
Okay, thank you. And I have one final area to follow up on also. Thank you, Madam Chair, and through you. I sent a letter to you, Madam Commissioner, regarding the federal teen pregnancy prevention and personal responsibility education funding that I believe is available, and I think New York accepted or received some, as well as the City of Rochester receiving some. And I was wondering I asked in that letter, and would just ask again this evening, if the county either applied or is considering applying or received any of these funds from this grant or program.
Through you, Madam Chair, I am familiar with the applications that were put forth from this community. Monroe County did sit at the table. Most of the work that is done related to teen pregnancy in this community, as it relates to what's being talked about in that grant, is done through the Metro Council for Teen Potential. Dr. Doniger, I believe, is on the full council board of directors, and then several members of Monroe County staff are on the working committee related to that. So they were able to participate in and vet the applications that went forward. There were two particular opportunities for grant application. One of them was to deliver an evidence-based service that would be delivered in the community where the need was the highest. And then the second was to actually deliver a program that is not yet evidence-based but offers promising practice and could be a bit more flexible in terms of where it was delivered. Obviously, the highest teen pregnancy issues are in the city of Rochester. We did support the grant. We do sit on the advisory council that will oversee its implementation and have input into how that program is done. It is through an evidence-based model that actually is designed to prevent teens pregnancy in program delivery, in a program delivery style. And we did support some other grants which were not received for the community, but we'll continue to monitor as an option as they roll out additional funds.
Okay, thank you. So we supported several grants, it sounds like, which is great. Was there not an opportunity for the county itself to apply, or was that not something that you were interested in doing, or was it just not appropriate for this sort of funding?
Through you, Madam Chair, I think it would be inappropriate of two government entities to compete with each other for those dollars. We are involved in assisting in the delivery of it, but I don't think that would be appropriate for us to compete with what they were offering. And that was something that we vet all of those applications as members of the staff of the Department of Human Services, and I actually believe members of the Department of Health as well assisted in the vetting of the applications. That doesn't mean that Monroe County isn't wholly participating in services that address the needs of teens in this community with regard to their choices around their healthy sexual behavior. And in addition to that, it certainly doesn't mean that we don't support young mothers. There are incredible investments made by Monroe County, just not related to the specific grant you asked me about. Today in the newspaper, for instance, there is a discussion of the Building Healthy Children program, which is extraordinarily supported by Monroe County. Nurse Family Partnership would be another example of that. We also, in our preventive programs, fund several programs for teen mothers.
Thank you very much. That's all I have. Thanks.
Any other discussion? There being no further business, the October 26, 2010 meeting of Human Services Committee stands adjourned. The next meeting of the Human Services will be on November 30th at 6 p.m. right here. Thank you.